Every single week, Dr. Cliff's going to break down a disease, and it's called Diagnosis of the Week.
I love that song.
I know.
I'm just going to sit here and listen to it forever. All right, for the first ever Diagnosis of the Week, we are going to talk about the number one reason why dogs go to a veterinarian clinic. It is not for shots. It is not for fleas.
Is it because there's a fenced and unleashed area?
Could be. Yeah.
I would
Yeah, it
enjoy
could
that
be.
big time.
That's a little inside joke there. It is actually for a condition known as otitis externa. Otitis externa is a fancy term for an ear infection.
Oh, thank God.
Yeah, we like to put things into Latin-y sounding words to make us sound smarter than we actually are.
It just sounds more expensive to treat.
That's exactly what it is. Ear infections are by far the most common condition seen in dogs. Again, why they're brought to veterinarian clinics. Common symptoms may be, Aaron, can you think of some?
Barking. Maybe the head leans like
Yeah, head leans to one side, definitely, especially if it goes into the inside of the ear canal and causes a balance problem.
What about panting?
Panting, yeah, if they're painful, absolutely. They're going to scratch at their ear. They're going to rub it along the ground.
Yeah.
There's going to be a bit of a funky smell coming from
Yes.
it, a bit of a bad odor. So you know all about that.
Yes, yeah. The doctor treated me.
So you're going to bring your dog in to see a veterinarian, and of course they're going to talk about ear infections, and they're going to talk about how ear infections are generally an overgrowth of normal flora, normal bacteria and yeast that occur in the ear canal. Something has changed in the dog's system that has allowed either the bacteria to overgrow, some nasty stuff like Pseudomonas and Streptococcus, or maybe the yeast will overgrow, the most common being Malassezia. Anyways, you get a yeast or bacterial infection. They're going to diagnose it by usually taking a swab and looking under the microscope because it is important to find out if it's yeast or bacteria. And then they're either going to prescribe some oral medication or some topical medication and sort of do a recheck in a couple of weeks and make sure it's gone. But the interesting thing that people don't realize is, yes, ear infections are the number one reason why you bring your animal to the vet clinic. It's also the number one reason why people go to a second veterinarian for a second opinion, that they're kind of angry that it hasn't been cured. And the biggest problem with that is veterinarians don't explain to people that the most common reason for chronic ear infections aren't swimming or, my dog's got hair in the ears. Don't pluck your dog's ears. That's ridiculous. That's painful. It's actually due to food allergies. So you get food allergies, and it causes itchy skin. It causes increased inflammatory chemicals in the body, and you'll actually get some swelling in the ear canal. And the ear canal is just an extension of the skin. You get some swelling. The air can't get at it. The wax can't be pushed out normally. You get sort of a change in acidity level from the oil glands, and then the bacteria, the yeast, start growing. So if you have chronic ear infections, don't just keep dumping in water and vinegar and some homemade eye of newt, wing of bat remedy that you found on the internet. Actually talk to your veterinarian, and if it keeps coming back, say, hey, doc, could this be food allergies, and what do I deal with that? So that is the diagnosis of the week.
Let me ask you something. Is it, do certain breeds get it more than other breeds? Or? I've been told, because Romeo, my lab, I've been told that labs are just, for whatever reason, they're prone to getting more ear infections.
Yep, they are. And the problem is that labs have a higher incident of allergies. So you put the two together, and that causes ear infections. It's not actually that, you let your dog swim at the cottage at the lake or whatnot. I mean, Labrador retrievers, they're supposed to jump into the water, right? As long as the water isn't like the Don River down here in Toronto, don't swim in there. If it's a clean water
source. Or the Mississippi,
the Detroit River, something like that. As long as it's a clean water source, you're okay. So, yeah, there are certain animals that are susceptible. Labradors, Westies, so West Highland Terriers, Cocker Spaniels. And, again, it's not because the ears are hanging down. It's actually because of things like food allergies and other problems in their system. So, but every dog can have it. Every dog can develop it.
Wow. That's the diagnosis of the week from
there you go.
Dr. Cliff and Dr. Cliff's Anatomy. Yeah. Sorry,
I don't know what that was all about.
Yeah,
Why are you thinking about my anatomy? I'm not sure.
I don't know. Just going to pass this over to my good friend over here. That's pretty interesting. Think about all those times. And the thing is, sometimes when Romeo has it, you go in his ear like this, and you take it out. You put your finger in, you take it out, and he's got that black
junk.
But he goes right into it. He starts licking it afterwards.
Yeah, well, it's because it smells funky, and dogs kind of like to clean stuff that smells nasty. But not to scare you, but when the discharge from the ear, when the normal sort of pale, tan, waxy discharge, which is normal, comes out a dark brown, and the darker, the more severe, that's actually blood. There's actually some inflammation occurring in the ear, probably a little bit of an ulcer, and a tiny bit of bleeding sort of mixes in with the wax, and it comes out that dark color. So I think we're going to have to take a look at Romeo's ears.
Yeah, Romeo and DeBomb's, because we've got lots of issues there, buddy.
Double check.
Double check.
I'll be happy to.